Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, addiction and recovery on college campuses. I speak with Noel Vest, an assistant professor at the Boston University School of Public Health. We talk about the role universities can play in helping students access recovery support and how recent shifts in stigma and greater understanding of recovery as part of a continuum of care and addiction are creating more opportunities for programs like these. Let's listen. Noel Vest, thanks so much for joining us on Public Health on Call. How are you doing today?
I'm doing wonderful.
Good. Well, we are glad to have you. Today, we're going to be talking about addiction and recovery on college campuses. But to start us off, would you please introduce us and tell us a bit about you and your work?
Sure. So my name is Dr. Noel Vest. I'm assistant professor at the School of Public Health in Boston University and the Department of Community Health Sciences.
Tell us about your academic career.
Yeah, it's very convoluted, and I'll try and keep it down to a 30-second version. But my life was ravaged by addiction, both myself and people around me. Up until 2009, I decided that I wanted to go back to school. And so I did. I thought I wanted to be a drug and alcohol counselor. I realized very quickly that I did not want to be a drug and alcohol counselor. But luckily, I was already in school. And so once I had kind of gotten on the on-ramp, I ended up getting my bachelor's degree, ended up going to grad school, and then ended up doing a postdoc, and then now here. And so my research or my career has been influenced by a lot of different things, not only my own recovery journey, but working clinically and then working academically with all of these things as well.
And tell us what kinds of things you study now.
So the main thing that I study is collegiate recovery programs. Another line of work that I do is secondary data analysis of the NIDA clinical trials network. So I do a lot of cluster modeling. I basically kind of put people into groups based on these responding patterns, whether it's depression or quality of life or other types of kind of what you would consider secondary or non-substance use outcomes, so that we can hope to understand the patients a little bit more. I think the clinical expertise that I bring is a firsthand perspective of kind of what those individuals look like in treatment. And then I would say that I dabble around in some criminal justice work as well.
So today we're going to talk about the collegiate recovery side of your work. And so to start us off, can you just tell us, what is unique about this particular population?
Well, I think one thing is that it's a very unique place to try and get sober or trying to enter into recovery, and for a whole host of different reasons, right? I think you're fighting against the social norms of that like developmental period, plus the college life, plus especially more recently, like our whole world is shaped by our social perspective, whether that's social media or whether that's within the college context of our friends or Greek life or all of those kinds of things. The other thing that's really important to kind of think about is that the alcohol industry, it's like pouring gasoline on top of an already lit fire of a very harmful narrative around the excessive use of drugs and alcohol within the college context. And so what you have is an environment where not using drugs and not drinking is actually seen as radical. And most of the time you have to, people are always questioning, why wouldn't you drink in this environment? So you can imagine that for someone where that's not a decision, but it's a treatment decision based on life and death, it becomes a very difficult time to enter into recovery, to sustain recovery, to maintain recovery. And so there's certain aspects about it that are, I think, very unique to that college experience.
And what do you know about, people entering into recovery at this age that are able to sustain it? Is this something that can, impact their lives?
Yeah, absolutely. I mean, I think that, this is one area where we definitely see that the success program or the successful individuals that go on, they've been involved in a collegiate recovery program or they're involved in a collegiate recovery program and it really has worked to kind of save their life because they have this environment or this context where their experience is really recognized and they're allowed to kind of flourish within this environment. And so I think from that aspect, plus, we need to understand the contexts that are important for recovery just generally, right? Whether that's the general population or whether that's within college contexts. I think the more that we can understand how recovery flourishes in these different contexts, the better that we can be prepared, especially from a public health perspective, to provide some of these resources.
So you recently wrote a piece calling on universities to really step up their recovery programs on campus. But can you kind of give us a lay of the land of how things exist right now? How well resourced are these programs? Are there great programs out there?
Yeah, as you can imagine, it's very location specific. I think that there are a couple of things that influence whether a school even starts a collegiate recovery program, and then kind of how successful that is long term. So, we did a study a couple of years ago as a kind of a prelude to the larger studies that we've done more recently. But we just wanted to understand how many collegiate recovery programs are out there. And so we did this web scraping where we took every website that exists college-wise, 4,000 colleges, and we scoured their websites for any mention of any kind of recovery-related resource. And what we found in that study was that there was 270 schools that had something, right? So they had either an AA meeting or a sober activity or something that they offered on campus. We found just over 170 of those schools had the actual official collegiate recovery programs. And then of those, about half had a student drop-in center. And, a student drop-in center, once the school has committed to its own space on campus for recovery, that really it seems to be a real turning point for some of these programs because the school is actually invested in the program at that point. And then, as you can imagine, among those collegiate recovery programs, we found, about 90% had some kind of mutual help group meeting, and about half of them offered some kind of sober activity as well. And so that's kind of the landscape. To get to the second part of your question, like what really constitutes a successful program or how do these programs, and it really does range, right? You have the Texas Tech program that has been around for almost 40 years now. They work from a very large endowment, and they've done just a great job of kind of cultivating their program through both recruitment, but then also really taking and showcasing their alumni as well. And so that's kind of like the pinnacle program that everyone is getting to. But most programs are less well-funded, usually no philanthropic funding, usually kind of dependent on either school or state level funding. And you can imagine that, those programs are much more apt to be defunded, especially if they only have one funding mechanism or one funding stream. And they just are not as robust as some of those other larger programs.
You mentioned drop-in centers. I mean, what does a robust, good wraparound treatment program look like for a college student?
Yeah, that just to acknowledge when we think about the disease model of addiction or the disease model for any disease, right? The way that we think about kind of funding, at least within the healthcare system, is that there's money for prevention, treatment, and then recovery. And again, you can think of that for any disease. So, but for this particular disease, substance use disorder, generally the services that these collegiate recovery programs are falling into the bucket of the recovery phase of the continuum of care. And so post-treatment, a good student drop-in center is so important because these student drop-in centers, they allow students, I'll say safe space, but they allow them an environment that they know they can go to. There won't be anybody using in that environment. A lot of these drop-in centers have study rooms. They hold their AA meetings or other kinds of mutual help meetings, all recovery meetings in there. They a lot of times have scholarly support as well. So academic support that they'll kind of weave into the drop-in center. But more than anything, it's just a place that they have that they can be around other students. It's creating community, right? And they have a place to create that community.
Is it peer-led or are there, like professional people on site?
Yeah, and it can be different school to school. Obviously, I'm explaining like one, I talked a little bit about Texas Tech, but it looks different. It really does look different from school to school. I would say the three pillars, and we've already kind of touched on a little bit, but the three pillars of a good program is that they have a student drop-in center. So we talked about that first, right? Some kind of peer support services. The example that I always give is the University of California at Santa Barbara. They have a very robust peer support network, and those people kind of run the meetings. They do a whole host of different kinds of things. Not a volunteer position. They get paid to actually do it. And then the other thing that is really important is they usually have some kind of mutual help group, whether that's AA, NA, all recovery, Dharma recovery. I mean, there's like, upwards of 20 different kinds of mutual help group offerings now. I think the better programs have definitely more than one if they can. And there's some that offer like 7 or 8 different kinds of mutual help groups. So the more that you can offer, I think the better. And then some other, I would say, this doesn't happen in all programs either, but some kind of either recovery housing or substance-free housing. So when I was at Stanford, they had a substance-free house right in the center of campus, which had about 30% of the individuals that lived in there were in recovery. And so you had this unique kind of atmosphere, this unique housing situation where the students that weren't in recovery really took on a strong responsibility of, making sure that the house was a very safe space for the students that were in recovery. And so some of the programs will have some kind of housing unit as well.
And so, many institutions have these zero tolerance policies for drugs and alcohol. So how do programs like this maybe coexist with that or kind of supplement that?
Yeah, and I think we're kind of moving away from that. I think for the most part, even schools that have zero tolerance or like campus that are completely substance free, they realize that substance use is still happening on campus within this age group. And so I think you're really seeing and I'll just say like the stigma around substance use. I think we've made huge, monumental movement from a very stigmatized condition 10, 15 years ago. It would just not be a space that you would think would be right, because in order for a college to say, yes, we need a collegiate recovery program, you're also saying at the same time, yes, we have a substance use issue on our campus. And so I think it has eased over time. And I think the schools that were the first to acknowledge that, and the schools that really kind of took the lead in realizing that, hey, we need to make sure that our students are cared for in this aspect. And so I think the stigma and the bias will kind of always be there a little bit. And I think that, as we kind of move into this public health way of thinking, I think that college administrators are slowly but surely seeing the value of these kinds of programs. Again, because we know that substance use exists across the board on college campuses.
You recently wrote an op-ed calling on universities to really step up, their campus recovery programs. And it aligned somewhat with this announcement about the Great American Recovery Initiative. So can you walk us through what that is and how you think this might be an opportunity for institutions to step up these programs?
No, it's a great question. And so to add some context, at the end of January, the Trump administration through ONDCP, the Office of National Drug Control Policy, put out the announcement on the Great Recovery Initiative. And it was basically just saying that they're going to put some resources towards the recovery phase of the continuum of care. As far as specifics about what they're going to do with that, it hasn't really been detailed too much. But I just want to make sure that I took the opportunity to draw attention to collegiate recovery programs, because most individuals enter into addiction or are diagnosed with a substance use disorder really in that emerging adulthood stage of their life. I just felt that it was really important to not just understand that, but to also understand that there were people that were also getting help in that early stage of their addiction career. In order to have these really robust collegiate recovery programs, we really need to think about how we can invest in that as well, because we're really investing in our youth. And I just think that's incredibly important.
And it seems like, college campuses, which are focused so much on community, it is a time of life where people maybe don't have as many burdens and demands, like they can really focus on their recovery. This seems like an amazing opportunity. Last question for you. If there's anyone that's listening that may know someone who is seeking a recovery program or maybe interested in starting one on their own college campus, are there any resources available that you would recommend?
That's a great question, and it's actually one of the things that we are working on right now. We're hopefully going to have within the next 6 months or so a really great toolkit that individuals will be able to access. But two other places I would definitely suggest people check out, I think it's a lot of really good information, is the ARHE, the Association for Recovery in Higher Education, which is kind of the body that is in charge of their national conference and providing support services. Their website is a good landing spot to kind of check out. And then the SAFE project, so Safe Campuses, they also have a lot of information, I think more on the student affairs side and how to kind of implement collegiate recovery. And that's a really great website or a really great resource as well.
Well, Professor Noel Vest, we will definitely be checking back in with you about that toolkit. Thank you so much for joining us today and for sharing your story.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.